Hello, everyone. Welcome to Girl Got Goals. I'm Marci.
And I'm Kimberly.
And today we're going to talk about HRT, which is short for Hormone Replacement Therapy. We're going to dive into the world of female hormone replacement therapy. What is HRT? Is it right for you? And if so, what are your options? So today's going to be full of information. And like I was telling Kimberly before we hit record, it's like we're not healthcare providers, so we can't, replace your doctor. And there's so much information that we want to cover today that we're kind of narrowing it down to just the important high points, just to make you aware of what HRT is and what are your options and questions to ask your healthcare provider, because everybody's situation is so different and so nuanced that we can't in an hour cover everything, nor can we diagnose everybody's specific situation. So we just really want to cover as much as we can, bring awareness to the topic, and let you know some things that are out there as resources so that you can really dig in and educate yourself and advocate for yourself, which is what Kimberly was just telling me, a story of a friend of hers who was on a specific type of estrogen replacement therapy called Premarin. And she was having a lot of bad symptoms, namely the first one being indigestion. And she just didn't feel like herself. And she knew something was wrong. And she was talking about this to her general practitioner. And he or she kept upping her dose. And she went to her OB, and her OB was like, no, I could have told you this from the get-go. With indigestion, Premarin is not right for you. We need to switch you to estradiol. And so you said just a couple of days after switching it, maybe even like a week, she was sitting at work one Friday and was like, God, I feel normal for the first time in forever. I feel like myself again. And that's kind of the experience that I think we are hearing over and over again with many women is, I feel off. I don't feel like I used to. I don't feel like myself. Something's not right. And you know yourself better than anybody else. And so kind of communicating that and relaying that to a healthcare provider is sometimes very difficult and very frustrating because they're not in your body. They're not in your life. They don't live your symptoms every day. They're just looking at numbers on a piece of paper. And sometimes that really just doesn't translate well. And so hormone replacement therapy is really like a new frontier for women. And it's something that all of us are kind of, just dipping our toes into now as the general public, and even knowing that it's available to us and that we can seek out these options, but they're really hard to find and really difficult to experience and really difficult to nail down. I think, we've had that same experience ourselves, just trying different things and different delivery methods and different types. And, it's kind of frustrating, but it's also like, if you never start, you won't ever get there. It's, you got to take the first step and keep just putting one foot in front of the other. And eventually one day, maybe you'll be sitting at your desk going, God, I really feel like myself again. And that feels amazing.
Yeah, I was so happy for her because I know she's been going through this. And, I feel like sometimes you just begin to think, what is wrong with me? I'm just a hypochondriac, or, because the doctor's out like they can't find anything wrong with you. And, like he just keeps upping this and upping this. So it just makes you feel like it's just you, and all along it's them because they don't want to listen, because they just want to throw something at you and not really try to solve the problem.
Or they really just don't
not
know
make you feel validated.
Yeah, they may just, because they don't get a lot of education, just like they don't get, they get one semester credit hour or one little class on nutrition. They probably get even less on hormone replacement therapy, and there's new stuff coming out all the time. So as much as there are healthcare providers out there that probably don't have the time, because they could be being pushed by their, office management. You have to see this many clients in this many, hours in the day. And so they're pushing everybody through in a certain time. They may feel pressured that way, or they may just not have the resources or the education. Not an excuse, but I did want to preface that with they may be doing their best to help you and their best isn't good enough. And that's okay. That's when you find somebody who does have the time to listen, who does take the time to educate themselves and find different resources. But I think, unfortunately, we have to be more educated than them in a lot of ways to advocate for ourselves properly.
Mm-hmm. Yeah.
That's what we're attempting to do today. Educate. Yep. Who would have thunk it? Us on podcast educating people.
Oh, that's kind of scary.
I know, right? So we got a lot to cover. I think we'll just jump right in. And the first thing we're going to do is just define what HRT is. And like I said earlier, HRT stands for Hormone Replacement Therapy. It is a medical treatment used primarily to relieve symptoms of perimenopause and menopause by replenishing hormones such as estrogen, progesterone, and testosterone that the body may no longer produce or may no longer produce at levels that bring optimal health. And who is it for? When to start and delivery methods. So generally for women experiencing moderate to severe menopausal symptoms like hot flashes, night sweats, vaginal dryness, mood changes, and sometimes those for high risk at osteoporosis. I know that runs in my family. So my family's very take your vitamin D, get your bone density scans. And so, my estrogen levels are going to play a huge part in that. So I'm very cognizant of that. So anybody, experiencing symptoms, like we said earlier, just not feeling like yourself anymore as you start to age. This could start in your 30s. You just start having symptoms of, it could be worse periods, or it could be mental instability, like mood changes that are, more significant than before. Or, I think once you get into hot flashes, night sweats, and vaginal dryness, you're in the thick of it. I really think you should be probably getting some kind of relief and some kind of help and be on the preventative side of it even before those things start happening. And that leads us into when you should start. That's a perfect segue, because studies show that best results and the lowest risks are associated with starting before the age of 60 or within 10 years of menopause. So some women could start menopause in their early 40s. So then really that age of risk for them starts 10 years later in their 50s, not 60s. So it really just depends on when you start hitting. And like I said, if you're starting to experience those symptoms during perimenopause, go ahead and jump on HRT. Go ahead and get some kind of support and relief for your body so that you're not hitting those risk factors later. And if we want to go ahead and cover the risks of HRT, we can do that now. Well, no, because it really starts with a benefit, because I'm getting ahead of myself. Because if you take HRT and you experience the benefits, then you mitigate the risks. So let's wait. We'll just keep going. So the delivery methods. Before we get into the benefits, we're going to hit delivery methods. That can be patches, which are transdermal. They just go on your skin and they stay there. I know my grandma takes an estrogen patch and she loves it. You have creams and gels. You can have peels that you take orally, or like the troches like you have that just dissolve under your tongue. And then you can do injections.
Yeah, I love my troches.
I want to start those.
They're so easy.
I know. I'm tired of sticking myself. I only have to do it once a week. But if I could just take the troche under the tongue every day, let it melt, go on about my business, that is so easy. And I can get my... Go ahead.
Go ahead.
I was going to say, and I can get my progesterone dosage right. I need 50 milligrams a day, but they stopped making 50 milligrams in the whole entire world. I cannot get it through any pharmacy.
I could sell you some.
I know, right? You could give them to me because you're my best friend.
I was looking at my
last forever.
No, I was looking at my drawer the other day, and I think I got like 4 bottles.
Well, I'll take them off your hands if you ever need
Well,
them.
let me see. That's what I was going to say. So, don't do what I do, people. Don't do what I do.
Do what I say, not as I do.
Yeah, and maybe Dr. Stokes will never listen to this. So, when I first started, well, last week's what got me to thinking when you were talking about taking the 50, and I said I thought I was on 20, but I couldn't remember. So the troches are 20. So I'm to take 2 a day, and it's 10 in each one. So that would be 20 a day.
Okay. Of progesterone.
Well, yes. So there again, I was doing what I felt worked for me. You're supposed to take 2 a day. So I was taking like 1 in the morning because I'm not here during the day unless I would take it to work with me. You know what I'm saying? And then 1 when I got home. But I felt like I was getting sleepy during the day. So I just started taking both of them at night. Well, remember last week we discussed that it takes at least an hour or so to work. I think it takes a little bit longer than that for me. That's just a personal thing. So I had been trying to take it on the nights that I trained my client before she got here so that I would be good and sleepy by the time I get done with her and I fix mine and Carrie's dinner and we go in there and get in the bed. So the other night when I trained her and I did that, I'm telling you, I fell asleep. We started to watch a show and I was out.
Good.
Like, I thought, oh, well, this is a
fluke.
One-time thing. Yeah. Well, let me back up for 2 seconds and hear me again. Don't do what I do because I shouldn't be doing this. So I got a little nervous about the estrogen because I've been trying to lose weight. And I was like, I'm just going to take it for a couple of days to see. But I took the progesterone, the 50s that I already had. Then I started feeling guilty. Okay, I'm going to mess myself up. I need to. Okay.
Girl.
Like I said, people don't do what I do. So I took the 2 troches and I took that 50 progesterone. That's the night that I just passed out. I didn't do it the next day. Didn't sleep as good. The next night when I trained her again, I did it again. Girl, it was almost like I told Carrie, I said, I'm not feeling good. I've almost felt like I had taken a sleeping pill and how you just get dizzy and groggy in your eyes. And so the next night, I didn't think nothing about it. And the next night I said something to Carrie and Carrie said, girl, he said, after you said, I don't feel good, because I just thought I need to close my eyes for a minute. He said, you were sawing logs. I mean, like in 2 seconds. He's like, you close your eyes and you were out. And I was like, I might get addicted to this.
I'm telling you, it's such like it's like a rest. It's like you feel tired and then you just feel rested and then you just like fall asleep. It's like a good sleep.
Yeah. Well, the takeaway of that was not that I was over medicating folks, but that I've realized that I think it's taking way longer for me. So I have thought about sticking some in a baggie and putting in my purse so that I would always have it with me because I don't want to try to remember to take them in the mornings. So that on the nights that I'm going to the gym, I can take it when I'm leaving the gym, because I do believe that is the key for me, is to take it earlier, because by the time I get home from the gym and I was like running around, getting everything ready for the night before, fix our dinner. I've told y'all that before. So it's like 9:30 sometimes before I'm even sitting down to eat dinner. And so you got to eat before you stick that in your mouth to dissolve. So I was taking it so late that I think that's one of the reasons why I was having problems getting up in the morning.
Yeah.
because then it's taken hours for it to really take effect into my body. And then once it does, then I'm wanting to sleep in the next day. I'm not wanting to get up. I've noticed a tremendous difference of how I feel of waking up. Like I got up at 7:30 this morning because I took it so early last night. And I know that's not like early, but for me on a Sunday to not feel groggy after I didn't go to bed till probably 11 last night. And I was ready to get up out of bed at 7. I mean, and like I was like awake, not feeling like I was run over by a freight train, which is
That's
how I
huge for
normally feel.
you. Yeah.
It is.
That is such a benefit. I'm so glad that you found that out. And like we're talking about, it took trial and error. You know,
Yeah.
it took knowing your body, knowing your schedule, knowing your lifestyle, and then trying it and, you know, seeing, not being afraid to adjust. And like you said, do as I say, not as I do. We're not advocating you skip your medication, but it took that for you to see, hey, I feel better with it. You know, and
Yeah.
then you're more likely to trust it. And for me, when I understand the root cause of something, when I trust it, when I know it works, I'm more likely to make it a habit in my life, you know, rather than just trusting the word of somebody else. I'm not really good at that.
Yeah.
I kind of have to learn from the school of hard knocks, you know, and learn for myself.
Well, and it probably wasn't, like you say, the best thing to do, but in hindsight, I mean, it wasn't like it was hurting me technically to
Right.
not for a couple of days to see, and then to realize that it takes me, because everybody's body is different, and it was just, I feel, taking longer for it to take effect and get into my system, that I need several hours. And I mean, for me, I feel like that was just a home run as far as figuring that out.
That's an epic
So
win for
I go
you.
to him Monday and I'm going to ask him about. So there again, you know, like I said, I did do that, but now I have some data to take to him. And so, hey, according to what my labs are, should we up my progesterone in my troches? And, you know, it'll be something to discuss with him.
Yeah. And I know you said your testosterone was still low. Last time you went, the level really hadn't changed much. That's the only reason I'm kind of hesitant on the troche, is because with my weekly injection, I have the levels that I prefer. And I'm worried that if I switch to the troche, that my testosterone levels won't be the same. But I know he can compound it to whatever level I need it
Correct.
to be.
Well, this last time he added an injection. So now I do the troche and a once a week injection.
Okay. Okay.
Yeah.
Yeah, I'm still going to talk to him about the troche for the progesterone, because I really would like to get that 50 milligram dose every day instead of having to get 100 milligrams every other day. Because it's like I get that really good groggy sleep every other night, you know, instead of every night.
Yeah.
I like
And
to
it
be
seems,
consistent.
yeah, seems like it would just kind of be a wave of up and downness doing it like that.
And I don't think, I mean, I know your hormones cycle naturally, and there are some hormone replacement therapists that cycle your hormone dosages throughout the month to mimic a natural cycle. There's one guy who has brought back periods of people who had stopped because he was mimicking the natural cycle, which is probably, if you're being honest, the best way to do it, because your body is made a certain way. But at the same time, like, I'm not having any more babies. Don't really need no more cycles. I like feeling the same every day. I don't like riding that freaking roller coaster of hormones, you know. So I would really rather have the same dosage every day and just keep everything the same.
Yeah, I agree. So I'm sorry we got off. So
yeah, no, that's a perfect leading into benefits of HRT, because, you know, you're talking about your progesterone causing you to sleep so good. You know, some of the benefits of HRT are symptom relief, can dramatically reduce hot flashes, sleep disturbances, vaginal dryness, and mood instability. And as we're talking about, give you better sleep, which insomnia, I think, is one of the number ones. Anxiety and insomnia are the two most complaints I hear from middle-aged women, or women going through any kind of hormonal changes. And those are both awful by themselves. You put them together, they're even worse. because if you're not sleeping well, your anxiety's through the roof because you're already on edge. Your nerves are frazzled. Like, it's a double-edged sword.
And I feel like you can be moody too, because you're sleepy, you're tired, you're irritable.
Your fuse is short. Yeah. You just don't have as much capacity for people when you're not rested well. And that just feeds into the anxiety. So other than symptom relief, you get bone protection. Like I said earlier, it helps prevent osteoporosis and related fractures, particularly in early postmenopause. And as we had talked about in our previous episodes in this series, estrogen helps with bone density, and testosterone helps with muscle. And so, strength training helps with bone density. So it all kind of plays hand in hand. If you have proper estrogen levels, testosterone levels, your strength training, that you're adding muscle or maintaining muscle, and you're putting stress on those bones, it's going to build your bone density, and it's going to put you at less risk for osteoporosis.
Well, also, I have read if you've got osteoporosis that has already developed, it can help prevent from any further loss or breakage. So, even if you already have a little bit of that also can be good to, help not further that along. My mother has that.
Mm-hmm. It's very common. It's more common than I think people realize, because my great-grandmother had it. My grandmother has it. My mom doesn't have it yet. I don't have it yet. But like you said, your mom has it. It's like, so that's 3 people I know in real life that have it. I don't know 3 people who have had, colon cancer, or whatever.
Yeah.
Or, some kind of degenerative eye disease. But I know 3 people have had osteoporosis. So it's kind of common.
Well, I would be very curious to know if they've done a study. This is just out of the blue. But thinking that it was your grandmother, my mother, things like that, that is all the older generation. I mean, I understand because they're older, but it wasn't advocated back then so much for hormonal replacement. It wasn't advocated back then so much for healthier eating, vitamin supplements, or working out. My mama ran, but I've never known of my mother to do any strength training or step foot in a gym. I don't think that that was a thing back then. So I feel like that a little bit of that education is developing more as far as that goes, that hopefully in our generation and our kids' generations, it will be less heard of.
Yeah, agreed. Maybe we can get rid of a lot of these things that are plaguing us today.
Yeah.
So other than the bone health and the symptom relief, the last benefit I have is cognitive benefits. Some studies show potential protection against dementia if started early in the therapeutic window, which is what we've discussed before, like 10 years before menopause, or typically age 60. So it's never too late to start, but the earlier you start, the better. And that kind of brings us to the study we were discussing, that the reason that HRT was kind of villainized was because of one study that was done, I think, in the 70s. It was, I think, estrogen hormone replacement therapy that was given to a range of women from like 30s to 60s to 70s. And there were some risks that developed as far as like certain health factors. And so it scared everybody, and everybody's like, hormone replacement therapy is terrible. It's going to cause you to get cancer, strokes, blah, blah, blah. We're going to stop. So a lot of healthcare providers were like not prescribing hormone replacement therapy because of the risks. And I think that's kind of what we're trying to come out of today. But when they went back, and this is also discussed in the Oprah special, if you go watch it, it's really good. Later analysis revealed that most risks were in older women. So it's women who were already over 60 when they started the hormone replacement therapy. It was long after menopause. And it could have likely been that proper HRT may have prevented some of these risks, and the care was too little, too late. So, in women younger than 50 to 59, the benefits often outweigh any risks such as breast cancer, heart disease, stroke, and blood clots. So, like I was telling you, what comes first, the chicken or the egg? Like, they found all these risks from HRT, but what I'm wondering is all these degenerative things have already happened to these women. They've been in menopause for so long. All these risk factors had probably already taken root.
Right.
And it probably would have happened anyway because of the lack of care that they received. Not that they received care. It was just too little too late to prevent anything. So they're that study's kind of being reversed. They're going back to hopefully more studies, which we also discussed before recording. I was like, we're talking all this stuff before we should probably be recording. We covered so much before. But, it's like there's been a lot of studies done on adult males. There have not been a lot of studies done on females. And this one study, like I said, was done in, I think, the 70s. And they really need to do a lot more studies and a lot more research now with better testing procedures and better lab equipment and better technology and more knowledge. There's so much more that we can discover today. And
it's like when they put those studies out, it's almost like anything else with the media. That's all you hear, cancer. Because if anytime you bring anything up, because it wasn't long ago, I had said something about it, and a girl was like, "Oh, I've just never wanted to do that. My mama said it causes cancer." But they don't come back later and say what the findings were, like what you just discussed, And then they didn't say, "Oh, well, we found that these women were older. Let's do, a more controlled study." No, we just dropped it.
Yeah, we got scared and we backed off. Yeah, it was like clickbait. You pick out one thing. And if you've ever read a scientific research study, they're very nuanced. There's often flaws in the research. You can't account for every variable. Some are better than others. And it's just, I think with statistics and math, you can kind of prove or disprove whatever you're looking for. Mm-hmm. You can take a research and have it funded by one party who believes one way, and they can find research to prove something. And then somebody completely on the opposite spectrum can find the same, or can do the same study and find a completely different outcome.
My hair is sticking up.
You got little fuzzies.
Yeah. And, I am no scientist. I am not the smartest person. That's Marci, as y'all can tell. I just sit here. But
I just read a lot.
I feel like, any other thing that I have like researched or, listened to as far as things like that, especially because I do listen to a lot of podcasts and a lot of doctors and a lot of things on working out, like what's better, the squat or the hip thrust or this, and they'll do these studies and there's all these variables. And so from what little bit I know, it needs to be controlled. And if you're not, if you're doing a study from 30 to 60 and you're lumping all these, that's a huge gap, in my opinion, that they did. And did you do like the health history of everybody? Because if this one has a history, like they could even do me and you and us be close in age. But if our history and our health is different, then that's going to be a variable. Are you putting mostly people together that are like people and then and group them, okay, these people are the same age and they have no health history. These people are the same age, but they have a history of this. I feel like that would have been a more controlled environment to give you a better outcome of what it was. If you just, let's take some volunteers and then here's what we find. And I feel like back in the 70s, that's what they were doing.
Yeah. Yeah. I definitely think that we have better awareness now as to what, constitutes a good research study. And, we're not going to get off into the rabbit hole because we got a lot more to cover, but we wanted to bring up there are risks involved with any medication that you take. And those risks are determined by many factors, as we proved with this study, age, background, history, whatever. And those are things that you really need to research for yourself and speak with your healthcare provider about. But I definitely do believe the benefits outweigh the risks in a lot of cases, especially when you're younger and just starting to experience symptoms. So we'll just leave that there because we are not doctors and we do not even attempt to know enough about it to tell you what to do. But we want to let you know, we're a big advocate on the benefits because we've experienced them ourselves, but there are risks. We did want to bring that up. So next is the type of HRT that you could receive. So the first type we'll discuss is bioidentical versus synthetic. So the bioidentical hormones are chemically identical to those that the body produces naturally. They can be custom compounded or FDA approved. And synthetic hormones, which are not identical to natural human hormones. And they may still be effective, but some studies link them to different side effect profiles. So just like anything, I believe the more closely you can get to nature, the better. The more closely you can get to what your body's already producing, the better it's going to be received. Some people are more sensitive than others. So that's just a route that you would have to, go with your doctor. I know there are more bioidentical estrogens and progesterones. I've never really looked into or researched bioidentical testosterone. I've never really even heard of it. I'd have to do more research on that. And that's something I probably should do because that's something I take every week. The next type would be estrogen only versus combined. So sometimes you have estrogen only HRT, which is typically prescribed to women who have had a hysterectomy or who are in full blown menopause. Like they have no more functioning uterus or ovaries. And the estrogen dipping is what typically causes all those bad side effects like hot flashes and night sweats and things like that. So some women, they can just take estrogen only, like my grandmother. She slapped on an estrogen patch and she's been doing that for 30, 40 years now, however long it's been. And she's perfectly fine. Me, estrogen touches my body, I go nuts. Not happening. So I do the combined HRT route, which is what you're doing with the troche. Could be estrogen plus progesterone plus testosterone. And it's for women with an intact uterus to prevent endometrial cancer, which is unopposed estrogen can increase the risk for. So like you and I, we still have, do you have a uterus? I don't think I've ever asked you that. Have you? Okay. You've never had a hysterectomy. Okay.
I had a hysterectomy. Mine's gone. I just have my ovaries.
You don't have a uterus. Okay.
Correct. I do not have a baby playpen.
Okay. I have one, but mine's been destroyed. We broke that hoe down and packed it in the closet. It ain't putting no babies in it no more. But progesterone, like I said in our last episode, is very protective of the uterus and certain uterine cancers. So you can have estrogen only HRT or you can have combined HRT. And then the third type is all natural remedies, which is where I started my journey. Natural or herbal alternatives to conventional hormone replacement therapy are often sought by those who want relief from menopausal symptoms without using synthetic or bioidentical hormones. And so, like I said, I started with Dr. Gay 2017, late 2017, I think. And I went through an endocrine reset protocol, which was a bunch of different herbs and vitamins, supplements that attempted to reset my natural endocrine system and have all my hormones functioning normally, which worked really well. It wasn't able to bring up my testosterone, and I still benefit from extra progesterone, but it did work really great. And I did like a wild yam complex. I had something with black cohosh in it. There's also red clover, maca root, chase tree berry, evening primrose oil, flax seeds. Even broccoli has DIM in it, DIM, and that is a natural, like hormonal balancing compound. And so there are many things. If you're not ready to like step off into the world of, pharmaceutical grade HRT, there are so many wonderful remedies that are natural that you can use to help mitigate those symptoms. Like I said, it's not going to probably increase your testosterone or your progesterone, but it can help you balance things better and feel better. And if you want to go that route, I would definitely consider finding like a naturopathic doctor. I know Dr. Gay with Olena Wellness is here in Mobile, and they are amazing. They're so amazing. They have a very long waiting list. So if you want to use her, you better get on the waiting list now. And there are some other ones I've heard of in our area that I haven't used. I don't have any specific knowledge for, but they could really help you know which herbs are good. And also the Health Hut in Mobile on Schillenders, they have some really knowledgeable people. I've been in there before. Sometimes there are things that Olena didn't carry, and they'd be like, you can go buy it at the Health Hut, and I would go in there and get it. And they were really instrumental in helping me through the years with certain things, because some herbs may be contraindicated or that you can't take with certain medications, or they may make certain things worse, or like there's some herbs that you take that you can't really go out in the sun. I'm trying to remember the one I took. I took one that worked really, really well, but every time I got in the sun, I felt like I was burning at the stake like a vampire. And now I can't remember which one it was. But so needless to say, just because it's natural does not mean it's not potent or effective. So you need to really look into that as well. So the next thing I have on the outline is access or barriers to finding care or getting prescribed HRT. So now we know what HRT is. We know who it's right for. We know the benefits, and we've discussed the risks. So now you've decided, okay, I need help. This is for me. I don't know where to start. I'm going to educate myself, and I'm going to find a provider online or in my area that can help me with my HRT journey. And the barrier to that we have found is a difficulty in finding knowledgeable providers, because many practitioners receive little or no training in menopause management. Like we just said, there is almost no research out there. It's getting better, but it's not nowhere near the amount of research they've done on the male reproductive system and the male hormones. And I think the male system is just more simplistic. Also, I think by nature, we are just more complex. We have more things at play. And so it makes it very intimidating for a lot of providers. And so patients often struggle to find HRT literate doctors, especially outside of urban centers, and we live in Mobile, Alabama, which is a fairly big city as far as Alabama goes, but it's nowhere near like New York or Atlanta or LA, where you may have the greatest, brightest minds collecting and people who maybe learn more, think outside the box. We're kind of dealing with the everyday run of the mill medical doctor, and so especially for women, it's very hard to find knowledgeable providers. But like I've said in the past, with telehealth and online doctors, don't be scared, because that's just them being able to expand their client base, and you can, just because you don't live in New York doesn't mean you can't see a doctor in New York, or LA. So that's,
I really think some of that is awesome that it has went that way, that we can do that. I mean, even some of them will Skype you. They'll send your labs like one person you and I both have used, which, I mean, Dr. Stokes is like that. He sends my labs in. So when I go see him tomorrow, he'll go ahead and send them in for 3 months. And then I just go and, like, he's already called me and adjusted my thyroid medicine.
Right. Yeah.
I mean, girl, I went on a Wednesday. When I woke up Thursday morning, I had already gotten an email at 4:00 that morning and a text message that LabCorp had my test results ready. I was walking into work at 8:30 and the doctor's office is calling me. Dr. Stokes has already reviewed your labs. He's calling you some new medicine.
Isn't he awesome?
Wham, bam. Yeah. So when you find the right one, everything runs smoothly. You just go get your lab work done. So it's that way, like if when we were seeing somebody else in another state, I mean, they called you on the phone, you discussed everything that you needed to discuss. They called in your labs, you went to a local lab person. It's really gotten easier to do things like that. So I know some people might be scared to begin with because at first I thought that was kind of strange. But honestly, in this day and time, I like it because we're all busy. If I could just drive down there in the morning before I go to work and get my labs, and then they can call me on the phone and tell me what I need to do, and I don't have to go in and pay you this copay to look at you and drive and take off work. It saves me time, and I think it's wonderful.
I agree. I mean, I'm really one of those old fashioned people that I feel like in person, sitting next to you, I'm feeling your energy. You're feeling my energy. Communication's better. Like I'm a person that likes to pick up a real book instead of an e-reader. I'm just that tactile kind of person. I'm big on feeling your energy in a room. And so for me, hopping on the bandwagon of telehealth and all this technology is like a double-edged sword. On one hand, it's completely convenient and necessary and amazing. On the other hand, it's very intimidating, especially for our generation, because we did not grow up in this realm. I didn't even have my first cell phone until I was like 18, and it was a Nokia brick, it didn't even have a screen on it. There was not texting, we had to wait till after 9:00 to call people because minutes were free. We didn't grow up in this technology laden world, whereas our kids, it's not going to be anything for them, especially with the pandemic. Everybody had to hop online. So there are benefits that, like you said, don't be afraid to try it because it does have its benefits.
Yeah.
And if we need to, we can always hop down to Grand Bay and go see him, and we go in person. But to have that hybrid therapy is really like the best of both worlds.
Well, and depending on, okay, so I'm like you in a way and not in a way. I still like my pen and paper. I just started like putting dates and stuff in my phone. I still have a calendar in my purse, and I used to go to the doctor's office and pull out my calendar, and Carrie be like, you can set that on your phone. I'm like, no, I like to look at it. I like to write out my notes. I like to write things. I like to see things. I'm like you. I like books. I did have an e-reader at one time, and I liked it, but I like a library of books. I'll go as far to say I'm weird because I like the smell of books. I'm one of these people that I'll sniff my book.
I mean, there's just something so like nostalgic about holding it in your hand,
Yeah.
And I think that's the same energy we get with our healthcare providers. We want to sit with somebody. We want to talk to somebody. We want to have that conversation.
Well, where I'm different in that aspect is I know that you are an introvert, and I told you I would never believe that, because I think you still, though, when you get in front of people, you are able to exert that with confidence and ask what you need to ask. I'm not. I was always one that when I would get in there, I'm getting better the older I get, but especially when I was younger, I would be intimidated. And even if I wrote notes down or said I was going to, I would feel stupid to get my notebook out and say, oh, I want to ask you this. And so when they would say stuff, I would just be like, uh-huh, uh-huh. And then I really wouldn't know why they're saying it, or I wouldn't ask questions. If, if I'm on the phone, and I'm not looking at them, I'm not as intimidated. Like I can
That's a
say
good
what I have to say
point.
on the phone. It's almost like being a
Yeah.
warrior behind the typewriter. Yeah, I can say what I want to say on the phone.
Yeah, I didn't think about that. Telehealth giving you that layer of anonymity, I mean, they know who you are, but they're not sitting there facing you, so it's not as
Yeah.
intimidating. Also, I communicate very much better through written word than speaking, because I can look at what I've said, I can formulate a response, I can think about it. And like you said, the questions, so it may be awesome to do telehealth and be able to email them and be able to kind of hide behind a screen, if you're more introverted, or be able to really think about what you're going to say before you actually say it. Or I know you've been in appointments too where you leave and you go, damn, I forgot to ask about that. Or I should have said this, or you start processing through, there's a lot of information thrown at you at that appointment. And then when you leave, you're probably like me. I start processing through that information because I am introverted and I am more nervous in social settings. And so I'm kind of like on guard and masking the whole time. And so I'm not really relaxed and processing. And so when I leave, I start processing information. Whereas if you're communicating via email, you kind of remove that. I've really never thought about that before, as that could be a huge benefit to somebody who's more introverted like we are.
Yeah.
Or, as you age, I know for me, my memory may not be as amazing, especially when I'm having a lot of information thrown at me, at one time. And so it may be beneficial to have those records to refer back to. Oh, what did he say that was? I need to research that. You go back to your notes. And I know Dr. Stokes is very good about that in our little app. There's visit notes. I think did you say you went back and read them before? Okay, so you can go back to your visit and read his notes in the app. And I was like, how cool is that? Because I can see how many doctors have said shit behind my back, that I didn't even hear because I left the room and they transcribed their notes, about what they thought about the situation, but it really wasn't communicated to me. So that's the benefits in technology. That could be a whole other episode. Shit. Let's get back to the barriers. So another barrier, the last one I wanted to mention, was insurance gaps. And so most insurance plans don't cover bioidentical or newer hormone replacement options. They only cover like the more conventional stuff that is synthetic and sometimes may not be tolerated as well. And what I've run into, most practitioners do not take insurance to cover their specialized services because their services are cutting edge. They're more on the leading side of things. And I know insurance is lagging, and their game is to not have to pay. So they have to really work on cash pay basis outside the confines of any kind of insurance premiums and coverage, because their services are not covered or they're not getting paid what they're worth for their services. So I know, like when we started seeing Kendrick at Forever Young, that was like a membership deal, which I think most hormone replacement therapy places are kind of doing right now. You pay like $100 a month and that covers your visits and your medication. And I think it was like, that was for like one prescription. If you had 2 prescriptions, it was like $125. If you had 3 prescriptions, it was like $150. So it's like a graduated scale. And I think I've mentioned this before, but I'm just now getting more information about it, where Club 4 is going to partner with a hormone replacement therapy clinic, a real medical provider, that they're going to have memberships available to Club 4 members. And Club 4 members get like a discounted rate. And it's going to start in the Birmingham area soon. And then I guess they're going to work out all the kinks, and then it's going to be, I think, pushed out through all the Club 4 areas. But it's the same thing. It's a membership basis. You pay, but you're paying out of pocket. I don't think your insurance covers that. If you have really great insurance, maybe you could get reimbursed. Because I know I see like a biodentist in Dothan. He does not take insurance for the same reasons. And I can get services provided, covered under insurance, but I have to go. I have to pay up front. I have to have a form that I fill out, and I have to mail it in to my insurance provider, and then they like cut me a check for whatever the reimbursed amount is. So you could look at your insurance and see if that's a possibility if you run into maybe a healthcare provider or a certain prescription not being covered. I know that most of the compounding pharmacies that I've used for specialized compounded prescriptions, which are usually your bioidentical hormones, they are not covered through my insurance. So I end up paying out of pocket for those.
I pay like, because they mail it to me, so my truckies are like $55. But that's not really bad. I mean,
that's three different medications in one, and that's for a month. So yeah, that's not bad at all. It's totally worth it. Especially once you start it and you see the benefits, it's like, what kind of price can you put on your health and feeling good and maintaining longevity and health throughout time? Like $55 a month, that's easy.
Yeah.
We could spend that at McDonald's taking the kids for a meal. It's just.
Matter of fact, I did a Whataburger the other day. When Colin brought me my card back and I sent it on my account, I thought, oh my God. For 3 meals, $49.
Yes, girl.
I gotta ask him. I think he got something else or something. Anyway.
Yep. And so lastly, we want to bring up how to find a provider, how to advocate for yourself, tips for talking to your provider, and then finding a specialist and community support. So self-advocacy is really crucial in menopause care, especially since many providers are undertrained in this area and systemic issues persist. So to equip yourself is absolutely a must. So there are some questions that we've jotted down that we feel are super important when like basically interviewing a provider. Like I think like your first visit is kind of like an interview to kind of see if it's a good fit. You shouldn't just take them, because they're the professional, they've been to school, they're a doctor, and they know better than me. Like, no, ma'am, we're not going to do that. And so most OBGYNs and primary care doctors are not menopause specialists. That's why it's helpful to find somebody in your area or online that is certified or deeply experienced in this area. Some resources to even start looking for a provider would be the North American Menopause Society. Their website offers a directory of certified menopause practitioners and telehealth services. You can Google menopause care in the U.S. and just kind of find even like what are some options in my area. And so when you've went online, you've looked through your resources, you found some certified menopause specialists in your area, great. We've read through their bios. We think this one's going to be a good fit. We make an appointment. We're to our first visit. So what do we do now? And this is when we have questions that we want to ask. And some questions that you might want to ask would be, do you have experience treating patients going through menopause? Simple question. If they're a certified menopause specialist, I would hope that would be implied, but still, you may want to ask, because then they can go, oh yeah, I'm certified in this, and this is where I went to school, and this is how long I've been treating patients with menopause, and this is kind of my line of thinking.
Well, even if, like, I hate to interrupt you, but
no, go ahead.
I know most OBGYNs are not, but I was very surprised, and I just want to throw this out there because I was like, yay, that is what my friend went to, is her OB. And so even if you started at that point because it's covered by your insurance and you can't afford the other, these are great questions to ask them to know if you even need to go any further with that particular
Yeah.
one.
And
You
your
might have to try.
OB may be a certified menopause specialist, or they don't have to be certified to have knowledge and experience. You could just ask your OB, hey, what is your knowledge and experience with menopause? I think I'm starting to go through some of the symptoms, and I'm just curious that, what's your educational background and experience in this? Because, like you said, I was pleasantly surprised also that your friend went to the OB and was like, this is the problem I'm having. And they automatically knew, oh, this is what's going on and this is what needs to happen. And
I
that's
should
very
have asked
encouraging.
her. I do know that it was a woman. I should have asked her what her age is, because I would almost guarantee that majority of the time, if it is a woman and she's younger, she's probably more educated than the older woman. That would be my opinion. I have no scientific background except for a couple of the experiences that I've had, because the older they are, they're still stuck in that what they learned in school
a long time ago. Yeah.
A long time ago, or they've already went through it and they suffered through it. They're just stuck in that mindset.
And, unless they're a woman who has went through it and has our mentality that I'm not just going to suffer in silence, I'm going to find help. And if they've been through it themselves and they've educated themselves and they've researched, because a lot of the men we're running into who have educated themselves, it's because their wives have been through it. So it was like a life experience that they had to go through with them, and they chose to educate themselves. So sometimes the older women might surprise you if they've had the experience themselves. But like you said, if they receive the educational background, which, I don't think med school's changed a whole lot, to be honest with you, from, the research that I keep hearing about the education that they're bringing as far as nutrition.
I will say I have heard that, but I like to think that, and when I say younger, I don't mean like fresh out of school. I'm thinking maybe 30s, 40s, to where they have our mentality of investigating this new information.
Possibilities change, like open-mindedness.
Yeah. For instance, and this is off subject again, but I still find it hilarious. So my children had a pediatrician, and I don't know about you, but every time my children would teeth, they would run a low-grade fever and they had diarrhea. But I would go to her and she says, that is not a symptom of teething. That's what they teach them in middle school. Now, this was when my kids were little. Oldest fixing to be 30 this month. I mean, I'm just 20, so I don't know but how that happened. But anyway, so then I had my next one. Same thing. She had the same symptoms when she was teething. She would have diarrhea. She ran a low-grade fever. I was told this is not a symptom. Funny, she gets pregnant. She has a baby. So the next time I go to her is with Colin. Now she's went past all of that, and she says to me, she's seen 1,000 people. She don't know that she used to tell me this, And she says, I used to say that is not a thing. They don't have diarrhea and low-grade fever when they teeth, but since I've had my children now, it is a thing.
You think?
And I was just like,
yeah, I could have told you that, dumbass.
I wasn't even a doctor.
I said it at the beginning of this episode. I have to learn via experience. I'm one of those people that have to learn school of hard knocks, that kind of thing. So I get it. If you've never experienced it, and when you go to medical school, you kind of trust that these people are teaching you the right things, and so what you learn, they drill it into your head. That's all the knowledge you have to go on. So who are you going to trust? Your high esteemed professors at your medical school, or some 20-year-old mom that walks into your office with a kid, that's just a regular person. I get it. It's hard, but with, like you said, the newer generations, I think we are more affirming. Women are becoming more affirming of other women. We are starting to become more compassionate about your personal experiences and validating that what you're going through is real and true. And that's so important, that we're not taught to mask ourselves anymore and just suck it up, put your big girl panties on and deal with it. I mean, these are good qualities to have in an emergency situation. If you have to deal with something hard, yeah, grit, bear it, get through it. But our personal health is not something we should have to grit, bear, and go through. And it's not something that we should have to fight our healthcare provider on. We should be aligned, and just like I have different experiences and different values and different beliefs about things, you have different experiences, values, and beliefs. You may resonate with a certain medical professional that I don't resonate with, and that's why it's great that there's all different types out there. It takes all different types to make the world go round. So we're not necessarily saying one is better than the other or one is worse. But just that you need to find somebody that you can trust, that you are aligned with when it comes to your health goals. And these questions are super important to ask, just to figure out if you are even aligned with this person. And you brought up an amazing point, as you always do, so practical. Like, you may not have to start over from scratch. You can just go to your OBGYN and ask these questions and to see, because you may think that you're communicating, what you want and what you need, and they may not be receiving that communication effectively until you open that line of communication. So asking things like, are you familiar with the latest guidelines from the North American Menopause Society? How many years do you have dealing with menopause? I think I'm starting to go through perimenopause. What type of HRT would you recommend for me and why? Are there non-hormonal options that I can explore as well? If this doesn't work, can we revisit my care plan in a few months? These are all questions that make you seem informed and encourage a collaborative conversation. So that you may can just start this conversation where you are. That's a great point. And then if you do not get the warm and fuzzies, if there is something in your intuition and your gut that's telling you, I don't think they're really seeing me, I don't think they're really hearing me, then look online and look for these resources.
If they're throwing up the red flags of not discussing your symptoms. And I think that was a big thing for me. And I don't know if it is for other people, like if you're going to this gynecologist, you've been going to them for a while, or you're a general practitioner. I always felt like I didn't want to ask for things like that because I felt like I'm asking for drugs. Like, I know that sounds stupid, but if they're making it so taboo, it makes you feel like you're asking for something that's like, I'm asking for some opioids, or I've come here to get something that you're like making me feel
seeking.
Yeah. You're making me feel uncomfortable, and that should not. I know now, and I feel now that a doctor should not make you feel that way. I mean, it would be different if that's legitimately what you're doing, but if you're doing it because you're advocating for your health and how you feel, then that to me became a red flag when I would discuss with the doctor and they would shut me down, or like I felt like they weren't listening to what I'm saying my symptoms are, and try to, well, let's do some blood work. Let's follow up on this. Let's, and at least evaluate. If they pull up the blood work and they show me in black and white, okay, this is not what your problem is. Okay, now what do we need to do?
Yeah.
But some of them were not even doing my blood work or even pulling the right labs to even know if that's what I needed. If you're not checking my progesterone, I'd been to doctor after doctor before. One of them that David had sent me to at the gym had even tested my progesterone and said, your progesterone's low.
Yeah.
And I'm going to be honest, at that time I was like, huh? What?
What is that? Yeah. What does that mean? I mean, I remember it plain as day when I was going through my dark night of the soul, that's what I call it. It was the worst experience of my whole life. Now I just know it's freaking perimenopause. When I was in the thick of it, when I finally decided to reach out to my OBGYN, she was the first doctor I went to try to get some kind of help or relief. She didn't even bring me into the exam room like normal. She brought me into her office. She was sitting behind the desk. I was sitting in a chair, and she was very dismissive of what I was going through. She was empathetic, like compassionate, but she was very dismissive. Like, this is very normal. I hear so many women go through this, especially at your age. Like, and I feel like looking back now, maybe she was almost at a loss. Like I hear this all the time. This is something that most women, I'm not going to say all, most women go through. I hear these symptoms over and over again. The best thing I can do for you is to give you an antidepressant. And my heart just sank. I was like, bitch, what part of I'm falling apart don't you fucking understand? And this has nothing to do with depression. Like, this is not mental for me. You know, I've had depression. My life is the best it's ever been. You know, you're not a psychologist. Please stay out of my brain. You know, this is in my body. You know, I'm coming to you. She did no lab work. She did no examination. She admitted that this is, you know, something that everybody goes through, but was very dismissive, as in, this is just something you're going to have to deal with, and I can put you on an antidepressant to cope. And I was like, her lack of willingness to like test and research and learn should have been a big red flag for me, but I didn't know enough at that time to know that these are legitimate, like huge red flag, textbook red flags, you know? And then I went on now it's a 7-year journey, and I'm still learning, you know, and advocating for myself and changing things and trying to feel optimal. But I've come through it on the most part. And once you've been through something, hindsight's 2020. Looking back, I would do it so differently now. And I counsel a lot of people against going to their regular OBGYN because of my experience, because that was not a good first start for me, you know. But with your friend's experience, that is extremely encouraging. And I would like to know who she sees, because I feel like, I might switch. But that's very encouraging to know that there are women out there or doctors out there who are listening and who are doing the proper testing and who do have the knowledge. But if you do go to your doctor and you're asking these questions and you're running against all of these red flags, especially if your doctor, like you've mentioned so many times, is scared of HRT. If they're scared to even provide it to you, if they're scared of, like, it's a drug and you're asking for something wrong, you know, that's like, next. That's not even somebody I'm going to waste my time on any further. I would almost be like, okay, interview's over. Thank you for your time. And walk the fuck out. But you got anything else on healthcare providers and how to find one, how to advocate for yourself, what questions you might ask?
Not that I can think of. I think we covered a lot.
Yeah.
Yeah.
So the last thing I wanted to touch on really quickly was like community and support. So support networks can guide you to trustworthy information and help you build the confidence to stand up for your needs. And so I think during menopause, isolation is common. As we get older, I feel like our friend groups kind of get smaller. You get busier. You're not really in contact with your girlfriends as much anymore. So you may not be talking about this in your normal circles, or you may be somebody like me who has very small circles and they may not be experiencing something like you. So connecting with others who understand what you're going through is crucial. It can be validating and empowering. And the power of sharing stories is just very cathartic. It's very healing. And hearing how others have navigated symptoms, treatments, healthcare challenges can help you do the same. And so you can find support like I said, either in your girlfriend circle, just maybe you being the first one to bring up the topic or to ask questions. Somebody may feel uncomfortable talking about it, just bringing it up. But once you bring it up, they may be like, oh, yeah, me too, or I've had this experience. And that can be a great first step because you already have like a strong connection with this person. It's somebody already inside your close, trusted circle, but it just may be you being brave enough to speak out. You may have a book club, or you may have an exercise class that you're doing, or a church group or something like that where you're in contact with other women and you can kind of start there. If you can't find somebody in your own personal circle, or maybe you just moved and you're trying to make new friends or something, you can go online, like online forums such as Reddit r/menopause. You can try Facebook groups like Menopause Chicks or the Menopause Support Network. Your local women's centers, like health centers, like hospitals and stuff, they may offer some kind of in-person or virtual support groups. And then the North American Menopause Society has educational platforms, which I haven't got on their website yet, really in depth to go look. But I plan on doing that in the near future just to keep myself educated and to see what kind of resources they have out there, because I'm only beginning my menopause journey. I'm just in perimenopause. I'm not even in menopause yet. So I still have a long way to go. So I plan on continuing.
I'm waiting on you to get to the hot flashes.
Girl, I have them at night. So I have night sweats, if that counts. Every now and then I'll have like a hot flash at night where I sweat, but not during the day in public.
I will say they have gotten better since, I have started this medication. But
they're few and far between for me now because I have a handle on it.
And I don't know, like I've heard of other women's like getting really bad. I feel like I'm gonna admit, when I had them, it wasn't great. But sometimes to hear other women, I feel like maybe theirs was worse. Like, did you see the video where the woman's like, it looks like she's at a football game, maybe?
Yes. And she has steam coming off her head.
Yes. I'm like, I don't know if I've been that hot. I have been hot so much.
It's like a physical representation of a hot flash. Literally steam rising from her scalp.
We were getting ready to... I think we were going to a wedding and I was trying to iron my dress. So now, or if you can imagine, I've took my shower, which will get your body temperature up a little bit anyway. Mm-hmm. And I'm trying to run around and get dressed. I've blow dried my hair. But now I've gotten so hot. I'm having a hot flash. I'm trying to iron my dress. I literally felt like I needed to get in the shower again because I literally had sweat underneath my boobs, running down my back, and I'm ironing the dress, and Kerry keeps a fan in the bedroom to blow on his face because he's all the time hot. He's glad when I have hot flashes because usually I'm cold. And I'll be like, turn the fans off. And I turn that fan on. I'm butt naked.
Blowing it up.
So it's blowing up my...
I'm going to say,
he walks in and I'm ironing and I got my butt out. Like, so it's blowing. There is nothing like when you're having a hot flash to have that cold air on your coochie. I'm just saying. And he walks in like, what are you doing?
I have that exact experience every time I get ready. Like, I normally don't fix my hair and put on makeup and blah, blah, blah. I'm usually in yoga pants and a Club 4 t-shirt and I'm out the door. But yesterday I went downtown with a group of girlfriends and ate dinner. And so I actually was like, okay, I'm going to do something with myself. I curled my hair, I put on my makeup, I had just got out of the bathtub, whatever. I'm sitting there butt naked at my vanity. There's nobody home. Everybody's gone. And Olivia FaceTimes me and she's talking to me while I'm getting ready and whatnot. And I'm like, damn, I'm sweating. She's like, you and Hannah's always sweating when she's getting ready. I'm like, yeah. It's like every time I get ready, I don't know what it is. My coochie's sweating. And I have an air purifier, like an industrial strength air purifier in my bedroom, and it blows air out of the top, and I go and I straddle it every time. Like you said, that cold air just rising because I can't put my clothes on. They're all sticky and wet. And so
So what you're saying is you're blowing instead of purified air, like
coochie hair
spot.
throughout my entire house. Hey, it's my coochie.
So when Jimmy comes home,
gone.
he's like, ooh.
He's like, what is that delightful aroma? I'm all of a sudden hungry. No, there was nobody home. So I was breathing my own coochie air. But then I put on my jeans. Smart me. I'm like, oh, I'm sweating ass. So instead of putting on a dress, I put on jeans and a shirt and I'm all dressed. And I'm still on FaceTime with her and I'm getting ready and I'm waiting on the girls were coming over to ride with me. And I get like 2 paper towels off the kitchen counter and like stick them down the back of my pants. And I'm like wiping my ass because it's sweat. She looked at me. She's like, did you just wipe sweat from your ass crack? I didn't think she could see it, but apparently she was like, Hannah does that all the time. She busted me. She knew what I was doing. I was like,
I'm not sure about my butt crack, but I will wipe titty sweat. I mean,
yep, get up underneath them and just.
Yeah. But one day it happened to me and I was at work and this was so embarrassing, but I'm trying to write a dude's invoice. I'm sitting there, I'm writing his invoice. He's like staring at me, standing at the counter. I can't concentrate. It just like, I got a little hot, then I got hotter and I got hotter and I'm sitting there like, whew.
So you were having a real hot flash.
Yes. And I'll turn around and I look and there's a fan sitting over there and I hated to ask her, can you turn that fan on? And it was Joy. Finally, I said, oh my God, I just had to say it out loud. It got to the point I couldn't stand it. I said, whew. I said, oh my God. I said,
this guy's looking at you.
I said, can you please turn that fan on? And she started laughing and she turns it on. I said, I am so sorry. I was like, but these hot flashes are real. And he just busts out laughing. I was like, I couldn't even think. It just like took over my body and I couldn't think. I just kept getting hotter and hotter and hotter till I thought I was going to die. And I was like, dear Jesus.
I'm going to internally combust right here in front of this customer. I thought you were going to say you were leaning over writing the contract and boob sweat started dripping on the paper. That would have been hilarious. One for the record books.
Oh Lord. Okay.
All right. So we're beyond our time a little bit. So I'm just going to wrap up real quick with the main takeaways. Number 1, educate yourself. You are the one responsible for your health. You need to educate yourself. Get your mind right, know where you stand on these issues, and then that way you can find a knowledgeable provider that aligns with your beliefs and values. Not that you can't be open-minded and change your mind, but you need to know where you stand on how you feel about all this before you go get swayed by somebody else for sure. Number 3, ask the right questions. You could probably Google questions. Hey, ChatGPT is a phenomenal tool that I've been using a lot lately. And you can type into ChatGPT, I'm going to see a menopause specialist about my symptoms, X, Y, and Z. What are some good questions to ask to make sure that they align with my goals? And ChatGPT will spit you out a list of questions if you don't feel comfortable, with the questions that are you. Sometimes when I sit down to like think of something, I draw a blank. I'm like, oh crap. I had a million questions before now, and now I'm sitting down like a playlist, like a music playlist. I always want to make a great music playlist of all my favorite songs. And then I sit down and make one and I'm like, I can't think of one song. So ChatGPT is your answer for that. And then number 4, reach out for support. Reach out to your friends, reach out to your mom, your grandma, your aunts, your family. If you can't reach out to someone in your real life, then reach out online. Reach out support groups in your area. I really think that it takes a tribe, just like we say that with raising kids, it takes a village to raise a child. It takes a village to be a woman. It takes a village to be healthy and happy and whole. And we're created for community, even though we're both introverts and we're shy and I'm so super awkward and not great in social situations. And it's very uncomfortable for me. I still miss it when I don't have it, when I'm finally forced myself into that social situation, like dinner last night, with some girlfriends. I can't tell you the last time that I did that. And it was very healing just to sit down and talk with them, just to laugh, just to share experiences, and I think if you can just maybe be the one brave enough to start the conversation, then you can find a lot of support that you need right in your circle that you have. And that's all I have for today. Was there anything else that you wanted to bring up? Anything we didn't cover?
Not that I can think of. We've covered everything from butt crack, coochie
sweat. Leave it to us,
Well, we had to end on something.
We got to say the weird thing. That's kind of my MO. It's never TMI, and I'm always going to say the weird thing. So if you found this episode helpful, please share this episode with somebody who needs to hear it. If you feel that we deserve it, you can like this and leave us a review. We would love to hear your feedback. Just reach out to us if you know us in real life. Text us. Tell us, hey, we're listening. My friend Belinda last night at dinner, the first thing she said when she came to the table after giving me a hug and say, hey, is I'm listening to your podcast. And it just made my heart smile. I was just like, thank you so much. It means so much to us.
Yes, definitely. And if you have any questions about, menopause or perimenopause or something you're going through, we might not have all the right answers. Yeah.
Yeah. I'm not saying we're really struggling for topics because there's so many things we can cover and we do want to cover, but we want to cover what's relevant for you. We do this for you. We love sitting here and talking to each other, and we could do this for hours, literally hours. It's like a time warp when we get together, but we sit down and we film this content. We research and everything for you. So we would love that if you could email us at girlgotgoals@gmail.com, and you could communicate with us there. You can text us. I'm taking a sabbatical from social media, so I'm not on Facebook currently. I'm not on Instagram. I'm not on TikTok. I'm not on Snapchat. I'm not on Facebook Messenger. So you have to email me or you have to text me. But you can still hit up Kimberly on Facebook and all of her social media. So,
yeah.
Well, until next time, just remember, progress isn't perfect.
But you are, so keep growing.
Bye.
Bye, guys.